Nanomedicines are nano-sized drug delivery systems. These are designed to only deliver drugs to the tissues of targeted tumors. Many nanomedicines are currently FDA approved and being used in clinical trials to treat diseases including cancer. Additionally, a lot of nanomedicines are awaiting FDA approval. In this presentation, we will investigate how nanomedicines are formed and how they work as cancer or other disease treatments. So, nano drug delivery system, we can call this system briefly as nanomedicines. The goal of the nano drug delivery system is to deliver the drugs only to the tumor and eliminate the tumor tissues. Tumor tissues may be destroyed if the tumor drug is put into a human body, but normal tissues may also be damaged. As a result, the tumor drug's various side effects cannot be avoided. To resolve this problem, the tumor drug is exclusively delivered to the tumor tissues via nanodrug delivery technique. The nanodrug delivery system is made up of a drug, a targeting region, and a nanocarrier. The drug is delivered to the tumor tissues by the nanocarrier, which is nano-sized particle with a drug and a targeting region attached to its surface or inside. Polymeric nanoparticles, liposome, ripped bilayer spherical vesicles, and carbon nanotubes are employed as organic nanoparticle carriers. On the other hand, inorganic carrier include metal and silicon nanoparticles. Targeting regions include receptor, antibody, and peptide. The nanodrug system uses the targeting region to guide the delivery of the drugs to specific tumor tissues. In the nanodrug system, drugs such as anti-cancer drugs, radionuclides, or genes are used. Now let's see the nanocarriers. The types of nanocarriers that can be used for the nanodrug delivery system are depicted in this figure. Organic and inorganic nanocarriers are two categories into which we can divide the nanocarriers. So these are organic nanocarriers and this is inorganic nanocarriers. Lipid-based and polymeric nanoparticles are examples of organic nanocarriers. There are numerous diverse structures within each class. So nanospheres, nanocapsules, nanodiscs, so various types of nanocarriers. Metals or other inorganic materials are used to form inorganic nanoparticles. Let's first see the organic nanocarriers. This is the fatty acid. Fatty acids are made up of polar head, and the non-polar tail. Right? And this is a phosphate structure. The head is polar, and two tail parts are non-polar. So lips are made up of fatty acid polymers. This fatty acid structure. They feature a small polar head with oxygen and a non-polar hydrocarbon chain for their tail. In contrast to the hydrophilic properties of the phosphate group head, the hydrocarbon tail, this is phosphate, hydrophilic, phosphate group head. The hydrocarbon tail of the phospholipids is hydrophobic. As hydrophobic tails. The cell membrane is made up of two phospholipid layers. This structure. The hydrophobic tail, hydrocarbon, is located in the middle of the cell membrane here. Whereas the polar head, phospholipid, sits outside. Here and here. Water therefore surrounds the outside of the cell membrane, interior and exterior. Outside, the water is surrounded. If the concentration of the phospholipid in the water is larger than a certain critical value, the nonpolar part of the phospholipid tail forms the core, and the polar part of the head becomes the surface containing the water. So in this structure, it is known as the micelle structure. So polar part becomes surface containing the water here, and non-polar part tail form the core here. So this is called the micelle structure. In contrast, when the phospholipid is dissolved in an organic solvent, the polar head part forms the core here, and the nonpolar tail part the surface. So here, so oil solvent outside. So this is called the reverse micelle structure. The liposome has a phospholipid bilayer and a spherical form with an empty core structure. So this liposome has a phospholipid bilayer, and also it has a spherical form. So liposome is made up of phospholipids, either natural or synthetic. So the hydrophilic drug is placed in the liposome's aqueous core. So hydrophilic drug can be put here, core, into here, water. while hydrophobic drug is placed between two phospholipid layers. So we can put the hydrophobic drug here between the tails. The nanodrug system with the PEG-coated liposome carrier can circulate for a long time in human body without being captured by the macrophage system. Moreover, magnetic nanoparticle-based MRI contrast agents can be inserted into the core to trace the system via MRA. So we can put the magnetic nanoparticle-based MRI contrast agent here and here. So we can trace the nanodrug system via MRI. The figures depict the micelle structure with water outside. The reverse micelle structure with the water core and non-polar solvent outside here. And the liposome structure with the bilayer of the phospholipids. Lips can also be used as solid lipid nanoparticles, lipid nanoemulsions, and lipid nanoparticles, in addition to the liposome structure. So we can construct using lipids, lipid nanoparticle, lipid nanoemulsion, or solid lipid nanoparticles. Okay. In particular, ONPATRO was the first lipid nanocarrier-based nanodrug system to obtain FDA approval in 2018. The corona vaccine was developed in 2020 with the identical lipid nanocarrier drug delivery system. So for manufacturing a corona vaccine, lipid nanocarrier delivery system is used, this structure. Here, mRNA was delivered to the cells by being encapsulated inside lipid nanoparticles, this way. The pegylated lipid nanoparticles effectively protect mRNA from the enzyme which breaks down the bare mRNA that has been introduced into the body. So it is easily broken. mRNA is easily broken by enzyme, but if we protect this mRNA by the lipid nanostructure, so you can deliver this to the cells safely. The delivered mRNA is used by the cell to produce the antigen protein, and as a result, the cells generate the antibody for the body's defense against the disease. This lipid nanoparticle delivery system was employed in the corona vaccines produced by Moderna and Pfizer. This structure. Nanodrug systems utilize lipid nanoparticle carriers. On the left, this one, it is depicted that mRNA is encapsulated by lipid nanoparticles. Okay. The drug is mixed with liquid lipid in the middle of the figure as colloidal form. On the other hand, the right figure right here is colloidal form. Yeah. On the other hand, the right figure depicts the rock as being mixed with a solid liquid. Here, the liquid is mixed with the rock system. And here, mRNA is encapsulated by the lipid nanoparticles. The biodegradable polymers are the building blocks of polymeric nanoparticles. PVP, PVA, and PCA, and poly-D and L lactide are examples of synthetic polyesters that are employed. Yet, these synthetic polymers might be harmful. As a result, other natural polymers are also utilized, including gelatin, ketosan, and sodium alginate. The volatile drug can be stabilized using polymer nanoparticles, and also mass production is also possible for the polymeric nanoparticles. To track the drug delivery system using MRI, targeting regions and the contrast agents can be attached to the functionalized surface. Here. On the left figure, here, a drug and polymeric nanoparticle are mixed this way. The toxic drug is enclosed in the core of nanoparticles that are shaped like nanocapsules in the middle figure here. So nanocapsule. The micelle structure on the right figure here is formed of amphiphilic polymer. So this polymer. Non-polar drugs may be inserted into the core here, in this case, while polar drugs are attached to the polar part of polymer. Here. There are three types of polymeric nanoparticles. Here, the drug and polymer nanoparticles are mixed together to form these spherical particles. And here, in the core of the nanoparticle, toxic drug is encapsulated in the core of the nanoparticle. And in this structure, this micelle structure, amphiphilic polymer is used to form the nanoparticles, and non-polar drug can be inserted into the core of the particles, and polar drug can be attached to the polar part of the polymer. Multivalent macromolecules constitute dendrimers. They have numerous branches, but a consistent form. So there are many branches, but they have some consistent structure. Monomers are polymerized to become dendrimers. The size and the shape can be controlled during this process. As dendrimers have a stable structure, uniform size, simple functionalization, and well-defined structure, they can be used extensively in the future. Drugs can be encapsulated or compressed to attach the dendrimer. As a nanocarrier, C60 fluorines and carbon nanotubes can also be utilized. Single-wall carbon nanotubes and C60 fluorines have a diameter of roughly 1 nanometer, or about half the size of DNA helix. The diameter of multiple carbon nanotubes, on the other hand, varies from a few nanometers to a few tens of nanometers. The C60 fluorines and nanotubes are filled with drugs, so drug can be inserted into the C60 fluorine or into the carbon nanotubes. Furthermore, targeting lesions may be attached to the carbon. Okay. The C60 fluorines and the carbon nanotubes are made using combustion, electric arc discharge, laser ablation, and chemical vapor deposition method. So there are several ways to make the C6 fluorine and the carbon nanotubes. Newly developed nanoscale materials include carbon horn structure, diamond nanoparticles, and nanodots. Nanodots can be utilized for a cell-based fluorescence microscope, since they are tens of nanometers in size and are observed by cells. As single particle biomarker, fluorescent diamond nanoparticles can be applied. Since pure diamond is made entirely of carbon, so it is transparent to microwave, ultraviolet, and visible light. However, if diamond has vacancies or finely mixed impurities like nitrogen, boron, nickel, it will emit visible light as a result of the fluorescence phenomena of the vacancies and the impurities. So in this way, we can see the fluorescent effect due to the vacancies or impurities. Now let's see the inorganic nanocarrier. Nowadays, organic nanocarriers like lipid, polymer, or dendrimer are used in most of clinical nanodrug delivery systems. However, inorganic nanocarriers might be used to produce nanodrug system that is clinically useful. Many types of nanocarriers are being researched, and some of them are currently undergoing animal testing. As a result, we can expect the emergence of FDA-approved nanodrug system with inorganic carrier. Because Twig's excellent electrical and mechanical properties, biocompatibility, high surface to volume ratio, ease of surface functionalization, and uses of established standard silicon technologies, silicon is considered as a suitable inorganic nanocarriers. So So silicon has many merits in manufacture and the properties. So silicon is considered as suitable inorganic nanocarrier. Silicon nanostructures have been produced in a number of shapes, including nanowire, nanoribbon, and nanodot. A silicon nanodot has excellent biocompatibility and no toxicity. It is applied as probe in fluorescence imaging. In fluorescence imaging, silicon nanodots will take the place of organic dye or nanoparticles containing cadmium. Fluorescence imaging enables us to see the biological activities occurring within living cells. Silicon nanopores can be used for antibody delivery. The porous silicon can be employed as nanocarrier of enzymes, deoxyribonucleic acid and platinum drugs embedded in it to the cells. It can also be applied to deliver synthetic growth factors to the cells. A nanodrug delivery system with the silica and the silicon as nanocarrier. So here. The silicon nanoparticles on the left here have the ferrite embedded inside of them. Here. This can be used as MRI contrast agent. The silica has a gold coating on its surface. Here, gold coating for nanobullet. The surface is subsequently functionalized by MHDA. The 6PT drug is next to placed to the functionalized surface. So surface is functionalized, and then we can put drug outside here, surface. In the right figure here, porous silicon's pores, here, pores, are filled with drugs, and the surface is then coated with a pack for biocompatibility. We can attach another drugs or targeting lesions to the surface due to this coating. So you can put other drug or targeting lesion outside here surface on the surface. The best candidate among metal nanoparticles is ferrite. By applying a magnet outside, we can drive the ferrite nanoparticle drug delivery system to the target organ. We can use an MRI to monitor the position of the drug system in real time, since this ferrite nanoparticle also acts as MRI contrast agent. Gold nanoparticles or nanoparticles with a gold coating can be utilized to make nanobombs or nanobullets. The gold is exposed to near ultra-red light. The gold nanoparticle drug system has been observed by the tumor tissues. So the gold is exposed to the near ultraviolet light after the gold particles drug system has been observed by the tumor tissues. This can be detected by MRI. Then the gold absorbs this ultra-red light and produces heat, which destroys the tumor. The term hypothermia therapy is also used to describe this tumor treatment. So if you use the near ultra-red light outside, then the gold nanoparticle absorbs this energy and produce heat, and this heat can destroy the tumor. So this is called hypothermia therapy. It is not necessary to coat the surface with biocompatible substance because gold is inactive and not toxic. So we don't have to coat the gold particle or gold coated nanoparticle because the gold is inactive and non-toxic. But for other metal nanoparticles, we have to coat with biocompatible polymers. Here are some 10 images of different shaped nanoparticles. There's spherical, there's a cubic shaped ferrite nanoparticles. So there's spherical ferrite nanoparticle and there's cubic shaped ferrite nanoparticles. And this is spherical gold nanoparticles. To continuously deliver drugs to the tumor site while avoiding being captured by body's defense system, nanodrug systems should circulate for a considerable amount of time. Smaller particles are difficult to capture. If the surface of a particle is hydrophobic, opsonin, which is a target for being removed. So opsonin marks the particle and phagocytes then eat it up. So the particle surface should become hydrophilic as a result. So if a particle surface is hydrophobic, then opsonin is attached on the surface of the particle, and then there is actually some mark for phagocytes, so phagocytes can capture dead particles. So to avoid this, we have to coat the particle surface with hydrophilic polymers. In order to this, for inorganic particles, hydrophilic polymer or surfactant is applied to their surface. For amines and polysomers and polysaccharides and others are utilized as coating polymers. The 10 images of ferrite nanoparticles are shown. This is cobalt zinc ferrite nanoparticles, which are coated by silica. So it's coated by silica here. The middle figure showed rod-shaped nickel ferrite nanoparticles which are pack coated, rather shaped nickel ferrite nanoparticle. These particles are coated with pack. And here, cubic nickel mangan ferrite nanoparticles, which are coated with triethylene glycol on its surface. The size of particles less than 100 nanometer.